A little late. Sorry, guys. I had to run around for a quick second. But I'm here. Hi, Crystal. Thank you for joining me. Hi, April. All right. No time to film. So y'all are benefiting. Because I gotta do a live. Hi, Sarah. All right. So tonight we are talking about transferable skills and how to put them on your resume when you're brand new, if you want to go into a coding adjacent position, right? So coding adjacent positions are really positions that you're going to use that's going to use your medical coding education, and kind of help you to build your transferable skills so that you have even more transferable skills. So we're going to talk about that tonight. I know that finding a job has its challenges, but it's not impossible. You have to think outside the box. I always tell you guys to think outside the box because there's everybody that's thinking inside the box. And I got a comment earlier today that inspired today's episode because I wanted to do this on a pre-film and just go ahead and film it and then be done with it, but I had errands to do after work, so it took a little bit longer than I had anticipated. So I was like, okay, well, I think they'll be okay with me being live, so it'll be all right. They'll be all right. Um, but I'll read the comment here in a minute. So one of the things that I will say this though is when you are applying for these jobs, a lot of people ask what are employers looking for. Oftentimes it's going to be right in the job listing itself, and if it's not, say it's like some kind of generic job listing, we're going to talk about how you can think of how to make yourself stand out. So if you are brand new to my channel, welcome. I am Blue. I'm a medical coder. This is a live because I did not have time to film. So, but I did get a message from somebody, and this is important. This is important stuff because finding a job, again, is one of those things. This is the shaping portion of getting into this field. If you were able to find a job right away after you finished medical coding school and got your certification, you are very lucky because that does not happen often. Okay. But this person said this: what skills should I put forward on a resume if I'm looking for a transitional job, prior authorizations, medical billing, thanks? And I said, did you look at the job listing? And they said, I did. I don't think these jobs know how to put what they're really looking for. And then she puts looking for customer service data entry skills. Everybody is looking for that. So here's the thing. Yes, some of these are not written by the health information staff, so they really don't know. But this is where you and your detective skills come in. If you want to apply for one of these coding adjacent positions, say you have not been able to get into medical coding, you've been trying to apply, you've been applying for a few months, and it's just not happening. Everybody wants experience, but you're still supposed to apply anyway. I have tons of videos on my channel about resume tips, but this is just going to be a little bit more of a supplement. So when you are out there and you're saying, okay, well, let me try to get in some other way, you want to go to coding adjacent positions that are going to use your skill, and they may not involve coding though, like actual hands-on coding, but it will expose you to codes. Prior authorizations is one of them. Prior authorizations is when the doctor's giving you the information. This is the information we have on this patient. These are their notes. Call the insurance company. I want to do this procedure on this patient. See if we can make this happen based on the evidence we have here. Is this going to be, paid for? And so then it's on the prior authorization specialist to say, this is the information we have here. This is the evidence that supports what the provider wants to do. Can we do this? The insurance company will say yay or nay. If they say nay, that means you got to go back to the provider and they said no because this is not covered because of XYZ. And so the provider has to go and figure out another plan. So that's what that is going to do, right? What prior authorizations, a position like that is going to do for you is it's going to get you exposure to the medical record, which is huge because when you are in medical coding, that's all you're doing is reading medical documentation. But this exposure will get you exposure to the electronic health record on top of the medical record itself. You're going to start learning how to abstract, which means pull out diagnosis codes, potential procedures, that kind of thing. So those are the things, well, mostly diagnosis on that side, but for the prior authorizations. But that's something that you're going to be able to connect because the provider's going to give you the potential procedure that they want to do, and here are the diagnoses. So then you're going to be able to start connecting those things. It's going to start to make more sense to you rather than you just being thrown into the deep end of the pool right out of school, right out of certification, and you feel like I still need a little bit more time to practice before I get into an actual coding position. Prior authorizations is a fantastic place to start. Again, because you're bringing over all of that transferable skill. Somebody that's applying for prior authorizations should have, especially if they have a certification, they should have all the things that they learned in the school. Anything that you learned in the school is your skill. I don't want to hear, oh no, Blue, I have not actually done that. I have not actually coded anything. You have training. You have skill. That is your skill. Skill does not mean this is what I do every single day. This is what I know. This is my skill set. This is the things that I can do, which is code. You should have ICD-10-CM. ICD-10-CM. Please do not put ICD-10 and then nothing. If you do that, if it's me, the hiring manager, this is the pile that we're going to hire. This is the pile we're not going to hire. Guess where yours is going? Into the pile that we're not going to hire. Why? Because this little detail just told me that you are not detailed. Because there's two ICD-10s. There's ICD-10-CM, your diagnosis coding, and ICD-10-PCS. If you can't tell me, and you can't expect me to assume that you just mean ICD-10-CM, I don't know if you could also do ICD-10-PCS as well, which is the inpatient procedures. I don't know if you could do that. And I need to know. So if you have that training, maybe you got an outpatient certification, but you do have ICD-10-PCS training, and you're willing to work with ICD-10-PCS, you could put that as well. If you don't have that, it's fine. But you need to put it on a separate line, okay? Because these are two different things. Because so help me, if I see also ICD-10-CM/PCS, again, where are we going? To the one that I'm not hiring. Why? Because again, it's showing laziness. That's laziness. It is. I don't care if you disagree with me. I'm telling you, as somebody, if I am a hiring manager, this is what I would be looking at. Because this is what I have experienced from other managers and seeing what they say, what they like and what they don't like. I pay attention to those things. So I'm giving y'all that inside clue. Because of course, there's always going to be somebody that knows more than I do, 17 years here, 17 years in this industry. I know. So I'm telling you, ICD-10-CM, one line. ICD-10-PCS, next line. CPT, okay, current procedural terminology. This covers modifiers, this covers E&M, it covers all of that stuff. You say CPT, that's good enough. HCPCS, you know that, right? You know that by the book that you have and the exercises that you've done. Medical terminology. You may think that that's just common sense, Blue. Believe it or not, common sense ain't so common. So you want to make sure that you have that on there because when you look at these job listings, they're asking for that. If they're saying they want customer service experience for somebody who does prior authorizations, that's somebody that doesn't know what they're looking for. However, if you put this on your resume, all of these things so far, medical terminology, anatomy and physiology, pathophysiology, your pharma, and if you can speak English, excellent, written and verbal, that's what they need to see. If you are bilingual, you need to put that on there as well. What languages do you speak? Can you speak them? Can you write them? That's what you need to have on there. And so those are your core skills right there. Because again, if I'm looking for a prior authorization specialist, I want somebody who's competent in medical terminology and anatomy for sure. And then you're telling me that you know ICD-10-CM and CPT and HCPCS. That's like catnip. I'm going to be very excited. I'm going to want to call that person. I'm going to want to say, you know what? This person understood the assignment. Let's give them a call. Unlike the person who puts on their resume no credential next to their name, no credential, and that they've worked in customer service. And in their skills list, nothing about what I just said, but they've got customer service, they've got smiling face, they can answer phones. What is the other one? They're a team player and they're organized. I'm not hiring that person because you're trying to tell me what you think I want to hear. And that's obviously not the case. I need somebody with technical skill. This person who's telling me all these things about coding because it's relatable to prioritizations, that's the person that I want. So that's what you got to do. And this is the same thing with billing. Billing, oftentimes they say, yes, we want experience, but again, you're applying anyway because you've got competence, you've got knowledge, okay? We need to apply this somewhere. Again, if you're applying for a biller position, what skills are you going to put on there? ICD-10-CM, CPT, HCPCS. This means that this individual knows how to do all of these things, right? ICD-10-PCS, if you got it. Medical terminology, anatomy, and pathophysiology. Why? Because again, the buck's going to stop with you before it gets out. The bill gets out. Say, for example, you're billing for OBGYN clinic and you happen to catch, before it gets submitted, before the bill gets submitted, you happen to catch one of the mother charts, right? Mother has delivered the baby. There is a baby code mixed in with mother's codes on that claim. Buck stops with you. You're going to be the one to be able to stop that before it gets to the insurance company, gets laughed at and rejected. Because we all know baby's codes do not go on mother's chart. Okay? So we're going to be able to stop that before it gets over there. You can stop it if you have to send it back to the coder. If there's a coder on staff, or if you're the one who the buck stops with you and you're the one who has to fix it, then you fix it before it gets out the door. So again, that's a skill that you're bringing into these folks. Doesn't matter that you haven't been a biller before. If you've worked as a cashier and you've handled cash, or maybe you worked at the hotel, you were a front desk check-in, you were working with credit cards and things like that, that's something that's going to be very helpful for that billing company, because that's somebody who can handle cash, who can count, who has basic mathematics, okay? And the mathematics that you need to know for a billing position, listen up, the basic mathematics you got to know for a billing position: addition, subtraction, multiplication, division, percentages, right? Fractions, that's what you got to know. Fractions only because when we think about like the bills and stuff like that, but it converts over to the decimals, so don't worry about that, you know. But like I'm saying, that's what it's going to be. And all of this math, it's not anything to hyperventilate about. I cannot believe how much people panic about math. Now, don't get me wrong, okay? When I had to take algebra, I was a little nervous, okay? However, I got through it because there's a lot of videos on YouTube that can help you with basic algebra, but you don't even have to have algebra for this. I'm just using that as an example. Because again, what are we doing? Percentages, multiplication, division, addition, subtraction. That's what we're doing when we are medical billers, right? Those are the important skills. I don't care that you can answer phones. I don't care that you're a team player. Everybody is a team player and everybody can answer the phone. Tell me, why do you stand out? That's why you stand out. Somebody who's telling me that they've got basic math down, that's the person I want, because everybody's going to be running the other way. Meanwhile, you're running towards the position and saying, yes, I know math. I got math down. You could put mathematics. You don't even have to put basic math. You could put mathematics, because again, everything's going to be done on a calculator. Okay? There is no geometry in this. There's no trigonometry. There's none of that advanced math. There's not algebra. There's none of that. Okay? It is all just basic formula math. Simple stuff. Okay? So that's something that you can do. Claims reviewer, that's the other coding adjacent position. Now this one, you're working on the dark side. You're working for the insurance company. You're working for Blue Cross Blue Shield. You're working for Aetna, and you're in there looking at those claims. Well, guess what you're doing? Oftentimes you're running them through an encoder, and an encoder is an electronic code book. And this encoder is saying, okay, it'll come up in bright red if there's an edit. An edit means that something is wrong with this claim. Either there's too much of this code, or it's a baby code on a mother's chart, you know what I mean? Or something like that. Pediatric code on an adult patient. So it could be anything, but it's gonna alert them, and they're gonna say, okay, we're gonna deny this claim. So guess what? Again, we're doing a few things, building our transferable skill in this claim reviewer position, where we're denying claims, you know, as far as like processing the claims as they're coming in and making sure that, is this okay? Is this not okay? So we look at this and we see that there's potential for denial here. Okay, so then we got to detail why. So what are we doing? We're building up our detail skill, right? Detail in making notes into why are we denying this. We have to understand the regulations when we're going to deny something, right? So again, what is this kind of position going to involve? ICD-10-CM, CPT, HCPCS, ICD-10-PCS, and all of these other things, medical terminology, anatomy, and pathophysiology, all of these things it's going to require. Again, the person who's not paying attention and who's saying, customer service, I can answer phones. Do you think that that's going to give any kind of spark for that hiring manager who's trying to hire for that claims reviewer? No. But the person who's saying, I just graduated from medical coding school. Here we go. I've got all of these skills here. That's what, oh, okay, cool. This is what we need to see. And when you get your certification, you better have your credential next to your name. This is the number one thing I do not see when I'm looking at these resumes that are posted on LinkedIn. You know, people will get on LinkedIn and they will be upset, which you should never be on LinkedIn upset. Okay, never be on LinkedIn upset. That would be like saying that you're drinking and posting on LinkedIn. Don't ever do that. Don't ever do that. Okay, because these are your future coworkers. So when I see somebody complaining, this is immediately the person that gets blocked. Immediately. No ifs, ands, or buts. I don't really care, because other people don't care that you're going through all this. Everybody went through it. I went through it. A lot of people go through that. But again, nowadays we are in a society now where everything is instant gratification. If you don't like something, drop it. Move on to the next thing. That ticky-tock. Every 10 seconds, they're running through something, right? All these foolish challenges they have people doing. But again, here we go on LinkedIn. I see them posting their 4 or 5 page resumes with just their name, their full physical address, which has no business being on a public forum. You put your city, state, and zip code. Okay? You put your contact information. If it's your email, you put your email number, your email on there. Right? But you put your name with your credential. Because if I have to do an Easter egg hunt to find out what credential you hold, the CCS, CCA, CCSP, or CPC, again, where is it going? Where is it going? To that stack that I don't want to have to mess with this, because these people don't know what we need right now. And we don't have the time as a business to sit here and handhold people. That's what they're looking at. That's why I'm telling you all. Not so that, you know, oh, Blue, you're mean. No, because I want y'all to be prepared. That's why I tell y'all. And I tell y'all in a way that, yes, is blunt and direct, because when I've tried to be, oh, so sweet and so nice, it doesn't work. It doesn't work. I get y'all's attention more this way, when I'm more direct. The more direct I am, the more the message seems to be impactful. I don't know. I don't know. But those are the 3 types of positions that you should be going after. Not patient access, scheduler. Now, while patient access and scheduler are vital to the hospital, medical secretary, medical front desk, reception, these are all very vital to the hospital. However, They do not require technical knowledge of the codes. Leave those positions for those people who are not in coding. Do not waste your time in those types of positions, because there's always going to be somebody, well, I started off in patient access and I got my job. Okay, but you are the exception and not the rule. Too many people are getting caught up in that trap. And I see a lot of instructors, they say, oh, yes, you should go into patient access. No, absolutely not. Absolutely not. Because if you have this skill, guess what happens when you don't use that skill? Because a lot of people stop studying afterward. Oh, Blue, I studied so hard in school and I studied so hard to get my certification and I don't want to look at another book right now. You're going to stop. And guess what? It'll be a year or 2 years and you're still in a patient access position with all of this knowledge and nothing to show for it, that you just been in the hospital for 2 years. Because guess what? If they like you in that position, you're not going anywhere. They will make sure that you do not go anywhere. So you have to think about yourself. Where can your skills best be used if you can't get a job as a coder right away? Prior authorizations, medical billing, claim reviewer. Those are the ones you need to look for. Those are the ones you need to be out there actively applying for. Because then you can use all of that transferable skill and build up your transferable skill and get out there and then get your job. But it'll allow you time to still practice and keep practicing with your workbooks. Because that's another thing people tell me too. Well, Blue, how can I maintain my skill? How can I maintain my knowledge? Get your workbook. Practice with your workbook. That's the way you maintain your skill. Is there anything else? No. There's no pill for that, right? There's no magic pill. The only thing that is going to help you be successful is by doing the things consistently. Doing the little things consistently, which is building your discipline on studies, right? And if you've already built your skill on those 20 hours per week, this is not going to be difficult for you. You're going to still be able to incorporate that while you're working in your temp job, right? Temporarily here in medical billing, because you're trying to make your way out into a coding position. And just because you get that billing position does not mean that you have to stop applying. It does not mean that you cannot still continue to apply for coding positions. Because guess what? The clouds may open and the door may be like, okay, you know what? We need a coder. And we haven't been able to find a qualified coder. So let's go ahead and start with the people who don't have experience. Whose resume looks good? Whose resume is only on one page? Who's giving us a cover letter that is not a regurgitation of their resume? Because the cover letter, that's when you can talk about that you're a team player, you know, that you get along well, or that you can work autonomously. These are all the things that can be put in this letter, right? So, all right. So, hi, Michelle. Hi, Lisa. Hi, Letty. I'm doing great. Hi, Art Mingle. Love your style. Tough love. Nothing but love. Thank you. Hi, Dee. Omnilist. Hi. I can see that, Blue. I want certification. Well, that's what you got to do. You have to work for it. You have to work for it. And when you do get it, you have to maintain it. You have to maintain it. And once you start maintaining it, there's nothing that you can't do. It took me 2 months to find my first job in coding. And the only reason that I was able to find it was because my mom said, you know what, why don't you go back to the school and talk to them and see if they know somebody. You know, so I went back to the school. The guy goes, well, I have a friend that has a temp agency. I'm like, why would I want to go to a temp agency? Because I'm thinking like manpower. He's like, no. He's like, these are for like specifically for medical professions. So I said, okay. So he goes, I have a friend. She's got her own business. And she deals specifically in medical. So I was like, okay, let me go over here. So I fill out the form and everything. I was like, you know, I'm a new coder. And she goes, okay, sure, no problem. And then she goes, take this test and then we'll see how you do. Excuse me. I took the test. And she goes, oh, you passed it. You did really good. I said, thank you. And she goes, okay, give us a week and then we'll get back to you. And I'm thinking, oh, here's another one, another rejection because, I've been hearing this, right? And I'm like, let me just go back to the bar because I got to go back and work at the bar because I was a bartender. I bartended, I cleaned houses, I worked at a halfway house for people who couldn't live by themselves. I had to sit there and watch them. Um, and it's not the easiest to do. Everybody thinks it's an easy job. It's not, because you're taking care of people who are not like able to take care of themselves too. So, that was a thing, And again, just trying to keep my head above water and make ends meet. And sure enough, in 1 week, I got a call back. She's like, well, we have a job. It's a 3-month assignment. And at the end of this 3-month assignment, they're going to pick somebody, one person only, and we're going to send 3 people. And we would like for you to be one of them. I'm like, well, absolutely. I can do that. And I'm thinking, okay, this shouldn't be hard to, win over these people and get this permanent assignment here in my hometown. I didn't get it. But, what is the saying? We plan and God laughs. Yeah, that's what happened. So I was told I did not get it. And it wasn't, they said it wasn't on technical ability. It's just that they could only hire one. And the supervisor wasn't the nicest person either. So that's okay, But she says, okay, well, we have another position, but you have to move. I had to move. Don't tell me you can't move. I don't want to hear it. I had to move. And I'm telling you my story. So I had to move. And because I didn't want to, but my mom says, oh, no, you're going. Because I said, oh, no, I'm not going. She's like, oh, yes, you are going. You are going. You're getting your experience and you're coming right back here when you have enough and you can find a job here. So she got me an apartment. My mom got me an apartment. And I went. And this assignment was supposed to be for 5 years because they had got a coding contract and they needed coders. And so I was like, okay. So I go out there. I learned about professional fee coding, which is not a skill that a lot of people have, especially when you're brand new, because it's kind of confusing. It's inpatient coding, but it's outpatient coding. So you have to learn a lot and you got to kind of think abstractly, about how to pick up things. But when I got there, they told me this position, we need a coder in, but we've had so many people quit because they couldn't handle the workload. They couldn't handle the pressure. Can you do this? I'm like, I got no choice. I moved here, I moved here. I cannot go back home. I have to do this, So here I am trying to figure this stuff out. No support, didn't know a soul when I got to this town. Did not know a soul. And this was my very first experience living alone, right? Because I went from my mom's house to my husband's house. And then when we were getting divorced, I went back to my mom's house. So this was my first time living alone, and it was not easy. It was not easy. And it was a challenge because when you think about all the things that when you have support around you, okay, you don't think about these things, I had a minivan because of course I was going to get pregnant and I was going to have kids and, so let's go ahead and have a minivan. So I had this minivan and I love that minivan. It was a Dodge Grand Caravan. I loved it. It was a sea green color. Beautiful. Very comfortable. Nice ride. But of course, I look like a mom, driving around in it, whatever. But I have this van and she decides she wants to start having a tantrum and start to try to break down as soon as I get there, right? And so, of course, I have to go get this figured out, and I have to, I'm calling my mom. I'm like, Mom, something's wrong with the van. And so she's walking me through everything. And so I have to go and take her into the mechanic and hope I don't get taken advantage of because they like to do that. And how do I know? Because when I was married and I had to go get the brakes done on our pickup truck, I went to go take it in because I was like, okay, the brakes need to be done. So the guy was like, oh yeah, you need this, you need this, you need this. Well, I knew there was only going to be a couple $100. And the guy quoted me, oh yeah, it's going to be 800 and something. And I said, oh no. I said, even I know that's wrong. I said, you need to go back to your little calculator and you need to add again. And my mom was with me. She starts laughing, right? And so the guy goes, it's 150. I said, that's what I thought. I said, that's exactly what I thought, sir. And I go, you know, my husband is not here. I said, but I know better. And I said, please, if I was to go to him with those numbers, I don't think so. He goes, I'm sorry, man. We'll get your car fixed. Yeah, you do that. You do that. Don't ever let anybody come at you like sideways like that. But like I said, I'm over here. And I'm like, I'm by myself now. I don't have anybody, you know, to kind of help me like, hey, you know. But you know, I was able to do that. They were really nice to me over there at the mechanic shop. So that was a good deal. You know, I was so glad about that. And I was up and running, and, you know, I learned and I was there for 8 months. And then I made it here to my forever home. And I've been here ever since. So, and this year will be 17 years. So doing something right. Alexandra says, what do you think about the Bucks textbooks? Everybody knows I don't like them. Are they good teaching material? Program I'm thinking of enrolling uses Bucks. Everybody, all these programs use Bucks. I don't know if it's like a contract thing. In my opinion, okay, there may be other people that like Bucks. In my opinion, there are better books to learn from. I do have Bucks books. I have seen the way that they are written. And I feel, in my opinion, that Bucks books are written for people who already know coding. And there's a difference between knowing coding and being a brand new novice, right? So the Nellie Leon Chizen book, if you look in any of my other videos that's not a live video, there's a whole independent study syllabus. It's got the title ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers by Nellie Leon Chizen. That is the #1 book I recommend for learning diagnosis coding. And if you're learning the inpatient procedures, the ICD-10-PCS coding, that is the #1 book for learning that. If you are not doing a test that involves ICD-10-PCS, you can skip those questions because there's plenty of diagnosis questions in there. And I recommend the CPC study guide. There may be other guides out there. I am with the HEMA all the way. This is not an ad for AAPC, but when I see an organization do something right for coders, I am the very first one to talk about it. So I do recommend, if you are sitting for an HEMA exam or you're sitting for your AAPC exam, get yourself the CPC study guide. You can go back a few years, 2022, 2023, 2024. If you want to get the current yearbook, that's totally fine. But trust me, the older books have the same questions and mostly the same answers. There's some updates, but it's not that bad, you know. But those two are the books that I recommend to learn from. And even if your school has Bucks and they're giving you that to work with, it doesn't mean you can't supplement with getting the Nellie book on your own and the CPC study guide on your own. I'm just saying, you know. Hi, Sonia. Hi, Anna. OmniList. It took me 6 months of applying to get my first medical coding job. I got really, really lucky with it. There you go. Jesse says, hi, I'm unemployed and I can't afford the 2025 books. Can I use the 2024 books for the CPC exam? So if you look at the AAPC website, it does say that you can use the previous year books for the current year test. However, they caution you and say that if you use a year older book, right, your coding manuals, and you are taking the test this year, the test this year in 2025 has already been updated with the 2025 codes. If they're asking you a question on that test and it's not in your 2024 book, just keep that in mind. Just keep it in mind, okay? Yes, it's all multiple choice, so you're just gonna have to do the best with what you got. But if you want to use the year older book, that's totally fine. AAPC says that's okay. Okay. But they're warning you that if you don't have all the information, you are doing so at your own risk for not having the 2025 book. Okay. Mila says, do you think that it is worth it for Actis? Yes, I do. Absolutely. Hands down. Actis is the best. They are the best. Hi, Larissa. Hi, Kumar. Could you please send us the notes and question that important in the CCS? Can you go to the AHIMA website and look up the domains and do that? And good evening, Larissa. But yes, that's what you want to do. Um, that's what you want to do when you are getting prepared for whichever way you're going to go with applying for jobs. Make sure that you identify yourself and your knowledge right away. Get to the point. Get it out. Just get it out quickly. Because if you don't, they're going to assume that you're wasting their time. Okay, so identify yourself with your credentials, identify all of your basic skills, and then think about all the transferable skills you have from the other positions that you're coming in that you've done before. If you have not done anything, and this is the thing that breaks my heart when I hear this from mothers. Oh, I haven't worked outside of the home because I raised my kids and, I've never worked. No, raising kids is a job, right? You have to know about them. You got to pay attention to things. You can't just be letting them go out there willy-nilly. So there's lots of things that mothers or stay-at-home fathers can put as transferable skill on their resume. So don't think that just because you've been raising kids that you can't put that on your resume, because even though you were not paid, you were still building skill. Because trust me, you're not the same person today as you were the day that your first child was born, right? Because the day your first child is born, you don't know you don't know which way to go, right? But now that it's been a few years, you know a few things. So even if it's conflict resolution, right? Your kids start fighting with each other. Who's going to break up this fight? The parent. So conflict resolution, that's one of your skills. Do you know how handy that is? I'm just saying, Renee says, hi, you may have a video on this, but do you have a proper way to tab? I don't do tabbing, period. All right, that's enough of you. Goodbye. Mila says, some advice regarding books that I can use for the CCDS. I'm sure they have a list, Mila. B says, do you have any future plans of perhaps starting your own training? Y'all don't want me to have my own school. Y'all do not want me to have my own school, because I think that, first of all, y'all would be the best, absolute, ready coders ever. You would be able to say, I went to Bleu school, I learned under her. Oh, say no more. So right now, there are no plans for that. But I'm just saying that as I am here is how I would be with this school. And it is a lot, because, of course, I'm going to take it personally. This is personal to me, because I would want everybody to succeed just like I want everybody to succeed now. If you are not doing your research, you're going to get called out for it. If you're tabbing your books, that's a no-go. Okay? I don't believe in tabbed books. Tabbing is training wheels for coders, because you still have to sit here and look at the tabs when you're trying to get through these manuals, and you only have so much time in order to get through your test. If you are depending and reliant on tabs, what are you doing? Do you see these books? Do you see these here? Do you see them? Do you see any tabs here? No. This is a workbook, so this is different. But do you see any tabs here? No. Completely clean. There's none of these silly tabs. There's no circling. There's no writing. There's no highlighting. I've seen people write so much crap, and that's exactly what it is, crap, in their books. Why would you do that when doctors and scholars have written these books and all the information is here? You just need to learn to use it. That's what you need to do. You look stuff up in the index, you go into the tabular and find the answers. It doesn't need you to write, highlight. You see this little space right here? Oh, let me write something here, because I'm going to make it look like I'm so busy on this page, like I'm really working hard. No, absolutely not. These books are to be respected. They are to be left clean. Every single one of these books I've had, I've left it clean. The only time I have done a demonstration, because I got asked for it several times, and y'all are relentless. So I had to do a CPT tabbing just to kind of show you, but I also told you don't need them. And it tears up your book. You have a ratty book. Why would you want a ratty book? If you're using good quality books, you're not going to have this issue. there's not going to be a need to write in these books for anything, okay? Because you see here, it's got all the information that you need in it. Optum is fantastic. It's never an ad for Optum, but everybody who watches my channel knows how much I love Optum. And all of the helps that go along in that book. And AHIMA and AAPC do allow you to use your choice of diagnosis book, your ICD-10-CM book, the Higgs-Picks book, and the ICD-10 PCS book. You have your choice of publisher, right? But when it comes to the CPT book, everybody's got to have the same book, the AMA CPT Professional Edition. So that means you can pick whatever diagnosis coding book you want. If you want to go with AAPC, that's totally fine. I do have an AAPC copy now. I mean, it's okay. It's got a lot of nice pictures in it and everything, but it still does not hold a candle to the Optum books. It doesn't. Optum books are better. They're better quality. They've got really good appendixes in them. They've got practices throughout. If you look in the ICD-10-CM book, before every single chapter, they have the guidelines. They have the guidelines, the coding guidelines in the front of the book. And then before every single chapter, they have the guidelines in there, right? And then you see this. I know you can't really see it, but you see all this, the purple? The white here is the guidelines themselves. And then the purple is where they're showing examples. They give you a question, they give you the answer, and they give you the rationale. No other book that I've seen for coding manuals does that. No other one that I've seen. And I look at books. So this is before every single chapter. Well, most of them, because some of them are just they're already connected to the other chapter. But I have suggested as a way to practice is you cover up those answers, you look up the questions, right? And then you reveal the answers to see if you got the answer right. And you go through and you practice every single one of these chapters. Guess who's going to be proficient with this book? Simply because you're using the book like you're supposed to. You're not writing in it, you're not tabbing, you're not highlighting, you're not circling. You're actually using the book for what it's designed for, which is a reference. That's what you got to do. And exploring this stuff, that's how you do it. And if you're learning ICD-10 PCS, right? See here? And it's a lot of questions they got. Some of them is 20, 30 questions almost. But ICD-10 PCS, if you're learning that, in the back, in Appendix M, like in Mary, right? They have 388 ICD-10 PCS codes to look up. So you look those up, and then they have the answer key there as well. So you're going to get a good practice learning your surgical approaches, learning the root operations. These are things that you have to know as a coder in order to be competent. But it's using the coding manuals. That's what you're supposed to use them for. And in the CPT book that everybody has, there's notes that a lot of people don't even read throughout. They have coding tips throughout here. Right? Look at this. Look at this. What is this? Other flaps and graphs. It explains everything. Right? It explains everything. And it gives you all kinds of good stuff in here. But all you have to do is spend the time to look at it. I have recommended before that you spend a Saturday and you flip these pages and you look at everything. You don't have to read it all, but at least just look at it just so you can kind of get familiar with it. And then look at this. On the inside flap, you have all of your modifiers here and what they are. And in Appendix A, in the back, they're giving you the explanations and examples in the back here, right? So yeah, Appendix A. And so a lot of people, believe it or not, there's people that don't even know that. But you learn it by spending time with it. And that's how you get good with it. You see, look at this. None of these tabs are used. And as soon as, trust me, whenever I have done that video in the past, as soon as that video was over, I took off all of those tabs. Because trust me, I didn't want them on there. But I did it for y'all because y'all wanted it. And AHIMA does say that you can use the tabs if it came with the book. So the CPT AMA Professional Edition, it comes with its own tab, so you can use it. I'm just saying that if you're practicing like you're supposed to, you won't have that issue. You won't have that issue. What do we got here? Marie says, "Hi, Blue. Is it was to apply before taking the exam, since it may take a while to get a job? Yeah. Is it wise?" Okay. I was like, what were we saying? Is it wise to apply before taking the exam? So sometimes employers will hire you without a certification, but they do not have to pay you the same as a coder who has a certification. It's a chance you take, right? It's a chance you take. But if you can get in without a certification, sometimes they will let you have like up to a year or so to get certified, right? Sometimes they let you have 2 years. Sometimes they let you only have 6 months. But you have to get your certification in order to stay on. And so that's something that some employers do allow for that. And then they say, okay, we'll give you a raise after you get your certification. And that's also possible too. But you may run into, well, we've already set the budget for this year, so you're going to have to wait till next year. So it's not a no for a raise, but it's not an immediate thing too. So that's just a chance that you take. But trust me, you're doing right if you can get a job before you get certified, because again, it may be a little bit harder, but you never know. I mean, you just got to take a chance. And like I said, a lot of people have gotten jobs as coders before getting certified, so it's up to you. Kay says, I'm planning to write the CPC exam in April. I'm new to medical coding, but have some experience working for an ACO. I don't know what that is. But am unemployed now. So when should I start applying for jobs? Whenever you get ready, when you want to. Sonia says, can I add notes of the updates of 2025 in my 2024 CPT? I have heard people do that. I have heard of people doing that. And I've heard that that's okay. But I would still double check to make sure, because again, I'm not with AAPC, but I have heard people do that. But you can still use that book, so it's okay, What about annotating for resequencing codes? For resequenced codes, oh, that's fine. Like if you know that there's one that like they're resequenced because they're not always in order. But it will let you know, the book will let you know that when something is not in order either. It'll tell you like where to go. So, I mean, there's really not, a reason to do any of that, because the book is already telling you. Valerie says, I love my Optum books. Yay. I love Optum too. So, but like I said, not an ad for them, but they know how much I love them. When I was at the conference in Salt Lake last year, of course, I ran up to them like a total fangirl, and I was just like, oh my God, it's Optum. Because the year before in Baltimore, they had a little tiny booth. I'm like, what happened? And they were like, well, we're coming out of the pandemic and, there wasn't enough people. And I'm like, I said, I hope you'll have like a big booth again. Sure enough, they had the big booth. So the big booth was back. And I was like, yes. And of course, they gave their books. They have their book giveaway at the end of conference. If you happen to go to Minnesota, of all places, I've never been. So I'm like, but it is in October. It's Minnesota in October. And they claimed, the people from Minnesota, the Minnesota chapter, they claimed that it's really nice weather in October in Minnesota. I don't know. It's just like somebody saying in Michigan, oh yeah, we got nice weather in October. Anyway, they were saying that it's nice weather, but if you attend, obviously they're going to have the exhibit hall, and Optum is always there, and they give away their books, their display books. So they have all of their books there. So they give out the display books at the end of conference. So you have to go and stand in line, right? And then you, as you are in line, they give you like 10 seconds to go select a book. So you're standing in line, and then they let a small group go, like 3 or 4 people, and then they go and grab their book, and then they go off. And so that is like one of the things that I look forward to every time for Optum. But I mean, I love Optum, and I always tell them that too. And the same thing with HC Pro, who has awesome books. The person was asking about Actus earlier. Codingbooks.com, that is the best place to get supplemental guides and supplemental books. Such an awesome but very costly website, and I love books, so but HC Pro is the best. Optum is the best. These are excellent books. Nellie, the Nellie book, the Nellie Leon Chisholm book, the one that wrote ICD-10-CM and ICD-10-PCS coding handbook with the answers, amazing. Okay, they also have the version without answers, but how can you effectively practice if you don't know what the answers are? I'm just saying. So thank you, Letty. Letty says, don't forget to do the thumbs up. All right. I appreciate that. Okay, so with that said, does anybody else have any other questions before I get to wrapping it up? I just want y'all to know that the more y'all do y'all's research, the better off you'll be. Okay? Don't ask questions that can be easily found on the websites. The excuse of, oh no, I can't find it. No, that's somebody that doesn't want to look. The AHIMA websites, you go right to that landing page. It tells you right there where it says certifications. And then it says the PDF for the list of books. It's right there. The domains. It says all the domains that are covered. There's that also as well. So you want to make sure that you're taking the time to look there. And when I'm telling you to look, you got to go to that website. There's no excuse. I don't want to hear it. I don't want to hear from anybody that says, oh no, it's not there. And then yesterday I did an episode. Let me say this before I say anything else, before I wrap it up. Y'all know I like to give y'all resources, right? So this lovely woman comes on there because I had shared about Just Coding, right? If you go to justcoding.com, all one word, justcoding.com, they have a free subscription and a paid subscription. Free subscription and a paid subscription. In the free subscription, they have some articles that are free, and they also have 5-question coding quizzes. When you go right to the landing page, as soon as you create your account, you'll see quizzes, free. Boom, there you go. This lady, oh, those quizzes are not free. I'm like, yeah, they are. I took a screenshot just so that she could see. Like, really? Why would you say that? Why would you say something like that? Did you even look at the website? Did you even do your investigation? No. You just came back to me and said, those quizzes are not free. Why would I give out a website and say that there's free stuff there and then it's not free? It's just stupid. You know what I mean? Like, that's stupid, but it's like, really? I would never do that. I would never. So just so you guys know, anytime I'm telling you a free resource, it's free. It's there. If you're not seeing something, maybe you need to refresh the screen or something happened, but it's there, okay? And I take the time to find these resources. I took the time to find those resources and put them there in the description box. Never replied back. Maybe because she found out that they were actually free and didn't want to look foolish coming back and say, oh yeah, my bad. Why would I do that? It's just stupid. Valerie says my son is in Mankato, Minnesota. Plan on visiting him before conference. Yay! Sonia says, Bleu, do you still offer to rebuild resume and cover letter, and what is in your offer? So it's a session that you book. It includes the resume reviews include 30 minutes on Zoom. It's a mandatory session. It's a mandatory session. During this 30 minutes, we talk about your resume, because you're going to send me your current copy of your resume. And the only thing I use it for is for your job history, like where you've worked and the years and stuff like that. and your demographics, like your city, state, and zip code, and your phone number, and your email address that you want to use that. And then we talk about your education and things. In this 30 minutes, this mandatory 30-minute meeting, we talk about all the things that you want for this resume. What kind of position are you looking for? And I model the resume after that. And because I do this, because we have this 30-minute session to sort things out, I do not allow for revisions. There are other resume writers that will allow you to go back and forth with them. I am not. I am not, simply because you're coming to me because you know that you either heard about the quality of my work, or you've seen, the feedbacks that I get from people that say when I rewrote their resume that they were able to find a job, and quickly. I would never guarantee my resume because it doesn't always work all the time for people, because it really all depends on where they're applying to. But the reason that I am very steadfast, and I'm not going to revise this unless I misspell something. I mean, that, yes. But I'm not going to sit here and add all kinds of silly things, because that one page is very, very expensive property, right? You have to look at it like this is what this employer is going to see. I had one lady come back to me, and she says, oh, well, I want to add my awards. I want to add my volunteer work. I said, you know how hard it was for me to get that to one page? It was very hard for me to get that to one page. So no, I'm not going to redo this, because again, I make it very clear there are no revisions for the service. And again, nobody's going to want to look at your volunteer work and your awards and stuff like that. They need to know, what are you there to offer them? Okay, so that's the thing that you guys have to understand, because I'm not here to waste anybody's time. Okay, so you get a new resume, newly formatted resume, and a new cover letter. You can edit these. All you have to do is load them into Google Docs. You can edit to change the job title, because I always put whatever job title you want to go for. But if you're applying for something else, leave everything the way that it is. You just change the job title. And that's it. Everything else can stay the same, because it's all on one page. Excuse me, for the resume, one page for the cover letter. And it's 7-day turnaround. Now, somebody asked me, well, if I already have the resume, why does it take you 7 days? Because I'm a writer. By nature, I am a writer. And what this means is, a writer is like an artist, in that you can't just produce like in the drop of a hat. Sometimes I will take some time to think about what was said in the conversation, what was said, and what my notes say. And I'll think about other ways of like highlighting their skills and things like that. That's why it takes me 7 days. And plus, you're not my only client. My calendar stays busy. So you're not my only client. There's other things that I'm doing as well. So when I do get around to it, okay, then I'm ready, and then I'll write it, and so then I send it back to you, and then that's it, but I do expect people to pay for their resumes beforehand, and I will not put you on my schedule until I get a payment from you. Because again, if you allow people to take your time, they will take your time. And I've had that happen a few times where people tried to do that, and I just don't have the time. There's other people that are waiting to make appointments, not to float my boat or anything like that, but I'm just telling you that that's the truth. There's people that wait to get booked with me. So no, I'm not going to make them wait for somebody that did not pay, So that's why I say, when we have our meeting, we go over what you want and what you absolutely have to have, and then that's it. And then whatever comes back to you, that's what you send out. And like I said, when you trust somebody who's been through the process and who knows, but like I said, I would never guarantee, because you can't do that really. In reality, you can't do that. But I will say that it's going to look a heck of a lot better than what it came to me with, I'm just saying. So, but yes, my contact information is in the description box below. So if you're interested, let me know. Marie says, in one video you mentioned someone found all the books for less than $300. Yep. Could you share where she found them? I have no idea. I have no idea, but she just told me where she found them. She didn't tell me specifically where, But there's a lot of places that you can go to that have cheap books, like abebooks.com, ABE books.com, all one word. They have cheap books. eBay has cheap books. The library, of course, has free books that you could check out. But Optum always has their books on sale, you know. Although I don't know, the price seems a little funky because they said that it's 50% off for their 2025s, but it's only the website's only showing 5% off, so that's kind of weird, right? So if you're gonna order from Optum, you need to give them a call and ask them, like, okay, what's going on, because this is not 50% off, you know, because it should be less than that. The books on Optum should be like at least $50, $54 or something like that. So that's where I'm assuming that she got those, or she found them. She found them by looking them up on eBay, or, you know, going through a thrift shop, you know, or whatever. Like I say, you don't have to get the specific books that I have, but you can get equivalent books. But yeah, so I don't know. I mean, Marie, we got to do research, right? Hi, Jolene. So yes, and D has the giggles. So yes, that's what I got there. But all right. Hope that answers everybody's question. Yes. I'll think of something to talk about for tomorrow. Y'all have a show tomorrow, so I won't have nearly as much to do tomorrow when I get home as I did today. So, but anyway, thanks you guys for being here. I appreciate y'all being a wonderful audience. And like I said, I tell y'all things because I actually do care. I give y'all hints on how to save money because I don't like to see people being taken advantage of. It pisses me off, you know, and I don't like that, you know, but then people think that there's something wrong with me because I don't want y'all to waste y'all's money. And then they think that I'm trying to, what is it? Gatekeep. And oh yeah, well, I want to get multiple credentials. Why? You just need one. You're a first year coder. You just need one. There's no job listing that says candidate must have multiple credentials to get the job, right? And if it does, are they going to pay you a differential for having more credentials? No. I'm just saying. Thank you, Crystal, Marie, April, D, Valerie. Sonia says, Blue, and it's BLEU. Sonia, you do not see? BLEU. I let it go like twice already. Now I'm going to say something. Hearing you today, you have an amazing gift for teaching. Thank you. Thank you for the help. All right. So with that said, I'm going to go ahead and wrap this one up now. Thank you guys so much for being a great audience, and I will see y'all next time. Like, subscribe, and share. Bye.